Hey guys, today we're going to be talking about numbness and tingliness. The reason why I'm thinking about this topic today is because yesterday the classes that I taught, the programming for the day included lots of overhead squats with a tempo, a hold at the bottom, and then after that you had to accumulate 2 minutes in that bottom position of the overhead squat. So some people, it was fine, they loaded up the weight and they were able to accumulate a bit of time. It was tough, take a break as they need, but they had a time cap and able to accumulate that 2 minutes. For those that didn't have a comfortable overhead squat position, they had to kind of struggle themselves into it. A few people over the course of the day gave me little complaints or mentioned that they're feeling a little bit of numbness in the tips of their fingers. So I wanted to address that. First and foremost, numbness is outside of my practice, probably outside of your practice as well. If you're feeling numbness and tingliness, that's not a good sign. Either take it easy, just stop altogether, let feeling return back, and or go see a doctor, go see your healthcare provider. That being said, as far as I'm concerned, as far as I know on the subject, I personally experienced that when I first started CrossFit. That was when I didn't have any shoulder mobility, T-spine mobility. I couldn't really overhead squat. So after doing a session of snatches, overhead squats, overhead work, I would find that night, whenever I was taking a shower, I would feel numbness and tingliness when I'd pass my hands through my hair. So I looked into it some more on my own, asked a few friends of mine that were doctors at the time, and they were telling me, and again I'm going to butcher this, but there's a nerve that's going through when your cervical vertebrae that comes all the way down in your hands, and if your traps are super tight, your shoulders are really tight, that nerve's getting impinged and it's giving you that feeling of the numbness in your fingers. Again, I'm not a doctor, this is just purely anecdotal data that I'm giving you guys of what I was feeling personally. It's probably going to be different from person to person. Anyways, if you conceptualize that a little bit, it would make sense that, and this could be in your hips for sciatica as well. I'm not just talking about the arms, but if you're tight in the shoulders, or even a different concept, if you're in a terrible internally rotated position and you're pinching off those nerves and you get tingliness in the fingers, that should be something that you're addressing. Not just the motor control to be able to put yourself in a good position, but if you don't have the mobility to be in there, underweight or whatever, then take the weight off. Or mobilize that position of restriction so you can get into that position without numbness. If you feel numbness, it's your body telling you like, hey, relax, back off, put me in a good position because I'm starting to feel numb. So as an athlete, just simply put, if you're feeling numbness, back off. Ask the coach. The coach will either tell you something similar to my experience and what he thinks, but he or she should either tell you to stop, relax, or refer out. Okay. That being said, if you do feel numbness and you push past it, and then it gets to a point where it's hot, burning nerve pain, well, that's kind of what's going to happen if you push through something like that, right? It's like if you have the element of your stove on and you touch it and it's really hot and you leave your fingers there, you're gonna burn yourself. Same thing, if you start feeling any tingliness and you just keep going through a bunch of overhead squats in a bad position or in a really tight position, then some things, maybe longer term, maybe over a few days, you might have residual numbness. That's not a good thing. So as soon as you feel it, you gotta stop and then ask the coach, ask a doctor, stop what you're doing, okay? Same thing goes for your hips and sciatica. If you're doing deadlifts improperly, or squatting improperly, your pelvis is turning under, and then you get some impingement there, it's going to pinch that sciatic nerve, be it in your lumbar or through the hip, and then you're going to start getting numbness down the leg. Again, I'm not a doctor, but it's really simple. If you mobilize, if you open up the deep six rotator muscles in your hips, which the sciatic nerve passes through, if you open those up and you have more availability for it to move, then it won't get pinched, or it won't be as tight so it won't get pinched. And again, it could be something completely out of my scope that's making that numb, that's having that numbness and tingliness, but before you go to a doctor, if you're starting to feel early onset of it, assess yourself, or have a coach or a PT assess you to see if you have tightness. If you have full range of motion, if you have full passive range of motion of your shoulder and your hips and you're experiencing numbness, then that's either a motor control issue or something completely different altogether that you need to go see a doctor for. So think about that. Are you in a good position? Yes, no. If I'm not, try to put yourself in a good position. If you can't put yourself in a good position, that's going to be a mobility issue, and your body giving you pain, giving you numbness is an early indicator, is an incident indicator before you get injured and you're permanently numb or you can't feel your fingers or whatever. One more thing I want to talk about is occlusive training or blood flow restriction. If you do it about the shoulders or the hips and you start feeling a little bit of numbness, there will be a very slight difference between numbness and between hot burning nerve pain. Kelly Starrett always says, if it feels like hot burning nerve pain, it's hot burning nerve pain. Get off of it. So for occlusive training, that's when you restrict all the blood flow and you go through a bunch of movements, presses, pushes, whatevers. And then you'll take that off and you'll have that huge onset of blood coming into the muscles. You can go with a little bit of numbness through that. Again, I'm not qualified to tell you to do that, and don't listen to me when I tell you to try occlusive training or try blood flow restriction training. But if you start feeling numbness, obviously if you know what you're doing, continue on, and 99.9% of the time, use that as an indicator like, hey, I'm pressing on some nerves, I'm restricting blood flow. That might not be the best idea, okay? So always think motor control first. You can't put yourself in a good position, or if you're not able to put yourself in a good position to lower the weight, try to. If you still can't do it, maybe it's a mobility issue. If you're missing mobility, that might be one of the reasons why you're feeling tingliness in your fingers, especially if you're a beginner and you can't really find that good position and you're really, really tight, you sit all day. Those are all going to be contributing factors. So clean those up. Ask your coach, see a doctor, because numbness, not exactly normal. Hope that helped out. If you guys have any questions, feel free to ask. I'll do my best to answer. All right? See you guys.